Hey there, Mr. White. My name's Kylie. I'll be your nurse, okay? I'm just gonna wash my hands real fast. So I heard the good news. You're gonna be leaving here in a couple of days. Yeah, I bet you're really excited for that one, huh? Yeah, I had enough of this place. Don't blame ya. So while I'm washing my hands and talking to him, I'm just gonna take do a quick QSIN, take a look at his general appearance, see if I notice any IVs, make sure I don't see any oxygen administered fully or anything. I'm gonna check the floor for any trip hazards. Wash my hands. All right, good. All right. So can you tell me your name and date of birth? Good. So as he does that, I'm gonna check his bracelet to make sure he is giving me the right information. Good. And can you tell me today's date? Good. And do you know where you're at? Excellent. Okay. Can you turn your head towards your right? Good. And towards your left? Good. So I'm going to check for JVDs. No JVDs are present. Okay. Go ahead and feel his skin. His skin is nice, cool, and dry. Good. I'm going to check his skin turgors, which are good. I'm going to check his capillary refills. Excellent. Can you squeeze my fingers? Good. And can you pull towards you? Excellent. And push. Good. Can you wiggle? Good. Any numbing or tingling when you do that? None? All right. I'm going to go ahead and listen to your lungs, okay? So I'm going to listen to his front lungs first, since he does have that spinal injury. I want to make sure I have someone else in the room with me to help me roll him. Yeah, just nice, slow, deep breaths for me. Good. Yeah, make sure I listen to his sides too, since he is always laying in bed. All right, I'm gonna go ahead and listen to your heart, okay, while I'm here. So I will listen to his apical pulse for a minute. His S1, S2 are noted. Normal rhythm. That. All right, so, my tech came in my room, so I'm gonna have her help me roll him. We're gonna do a log roll because we wanted to protect his spine. So I'm gonna go ahead and roll. Good, that's good. You just take a nice slow deep breath and listen to your lungs. Good. His lungs are nice and clear bilaterally, anterior and posterior, which is excellent. All right. Good. Have you been coughing at all? No coughs? Good. Go ahead and listen to your belly really fast, okay? So as I lift up his gown, I'm going to check his abdomen. I'm going to see if he has any drains or anything, any scars, incisions. His belly looks good. I did also notice too, when I had him rolled over, when I was listening to his lungs, I would have checked for his skin too. Check for any redness, especially around the coccyx area from the pressure. His skin was nice and intact, no redness as far as on his skin. Okay. Go ahead and listen to his belly. And his incision was nice and dry. There was no drainage from his incision. All right, so he has bowel sounds in all four quadrants. Okay. When was your last bowel movement? Yesterday? Was it normal? Soft? Okay. All right. Let me know if this hurts. I'm going to feel your belly. Any tenderness or anything when I touch? No? Okay, so no tenderness. All right. So I'm going to go ahead and feel your legs. His legs are nice, cool, and dry also. I'm going to go ahead and feel his pedal pulses. His pedal pulses are present bilaterally. Good. And check his capillary refills. Good. And can you push down? Good. And pull up. Good. Can you wiggle your toes? Good. Any numbing or tingling when you do that? No? Excellent. All right. So I'm going to go ahead and grab your vitals, okay? Go ahead and grab his temperature. For his temperature, I got 98.3. Good. Go ahead and do your pulses. I'm going to feel both his pulses. His radial pulses are present bilaterally. Good. And then I'm going to just count for a minute. So after a minute, I got 75 for his pulse. I'm going to count his respiration. So I count that for a minute. I got 16 for that. Okay. And then I'm going to go ahead and grab your blood pressure, okay? So I put the cuff on his arm. Go ahead and check his blood pressure. For his blood pressure, I got 118/70. And then his O2 stat was 99%. Good. Are you having any pain at all right now? No pain? Okay. Do you need anything? You're good? Okay. So the CNA will be in here in a little bit, okay, to give you a bath. Is that all right? Okay. So I'll let her know that you're wanting your bath, okay? All right. So I want to make sure he had his call light with him before I left the room. Okay. Hey there, Mr. Wright. So the CNA just told me that your blood pressure is a little high now after your bath. Okay, so I'm going to go ahead and recheck your vitals, okay? I noticed just looking at him, his skin is nice and flush. His cheeks are nice and rosy right now. So I'm going to go ahead and he's kind of breathing a little bit faster. So I'm going to go ahead and grab his temperature. Go ahead and turn. So for his temperature, I got 103.6. All right, go ahead and count your pulse, okay? So I've counted his pulse for a minute. After a minute, I got 56 for his pulse, so that's decreased from earlier. Count his respirations. I got 20 for his respirations. All right, and I'm going to go ahead and grab your blood pressure real fast, okay? So I'm going to go ahead and check his blood pressure. For his blood pressure, I got 189/100, so he's hypertensive. Oxygen's 98, so he's still setting good on that. She did let me know that he didn't have a bowel movement and he was not incontinent of urine either. So with his spinal cord injury, we definitely want to watch that. So I'm going to listen to his abdomen again to make sure he still has his bowel sounds. All right, so I'm going to go ahead and listen to your belly, okay? All right, so he still has bowel sounds in all 4 quadrants, which is good. Okay, I'm gonna go ahead and feel your belly, okay? Any tenderness or anything when I touch? Nothing. His belly's still soft and flat, no distension there. I'm gonna make sure that I feel over his like pelvis bone, pubic area, and feel for his bladder. I don't feel his bladder, so his bladder is not distended, so he's not obtaining any urine, which is good. He has let me know he is feeling a little anxious, which would explain why his respirations have increased too. All right, hon. So after taking a quick glance on him, I haven't noticed anything that's different. So I'm gonna have the tech help me roll him. So Liz is gonna help me roll, okay? We're gonna roll over towards your right, okay? So we're gonna make sure we do a log roll, because we have to protect that spine. So we're gonna go ahead and do a log roll real fast. So we're gonna do a log roll, okay? I'm gonna start from the head and kind of go down and look, make sure I don't see anything. No redness up by his shoulders. His incision still looks really good, and down by his lower back, I've noticed we have a washcloth. So this could have caused all his symptoms, which would be the autonomic dysreflexia. So we will remove the washcloth. I'm going to look at his spot, which was on his lower back, which is red. So I do want to make sure and note that. I want to keep an eye on that to make sure he doesn't get a pressure ulcer from that. His coccyx still looks good. I'm going to make sure the sheet is nice and flat, no wrinkles, because even though he can't feel that underneath of him, it's still going to irritate his skin and cause him to go to that autonomic dysreflexia. So we do that. All right. So we got the washcloth out from him, underneath of him. His bed's all nice and straight. I'm going to document about that red spot, keep an eye on that red spot. I'm going to let the doctor know about your blood pressure, okay? Is there anything that I can bring you when I come back? Okay, hon. So I'll make sure that I give him his call light, and I'm going to go ahead and go talk to the doctor, okay? I'll be right back. All right. Hey there, Miss Bright. So I brought some ice packs with me, okay? Try to help with that temperature, because remember you had that 103.6. So I have a couple of ice packs. I'm going to put those underneath his arms to help cool him down. I'm going to go ahead and grab a cool washcloth too, okay? Go ahead and put this on your forehead to help cool you down. The doctor did order you some nitroglycerin, okay? And that's just to help with that blood pressure, because that was pretty high, okay? It's a sublingual, so it's going to go underneath your tongue, okay? I don't want you to chew it or swallow it. We're just going to let it sit underneath your tongue and dissolve, all right? Okay. So before I brought in the medication, I want to make sure I had done my 3 checks. So I did my 3 checks. Can you tell me your name and date of birth? Good. So that information is correct. I want to make sure that he didn't have any allergies, which he has no known allergies. I want to make sure I have the right patient, the right medication, the right dose, and the right route. And then I also want to make sure I get the right response with the medication. So you might feel a little dizzy, okay? So let me know if you get a little dizziness or a headache, okay? I also want to make sure that I do watch his blood pressure, because it can cause hypertension. And then I also want to make sure I pay attention to his heart rate, because it can cause tachycardia. So I'm going to go ahead and grab the medication. Make sure I wash my hands, put my gloves on, check his medication, and grab his pills for him. All right. Can you put this underneath your tongue? So he grabs the medication, puts it underneath his tongue. So this should work within the next 5 minutes. I'm just going to stay in the room, do some charting. I'm going to chart the date and time, the medication, the amount that I have, and the route. I also want to document the blood pressure and that he had beforehand. So as I do that, I'm going to have a little talk with him too, since he was a little anxious, just kind of help him with his anxiety a little bit. Just talk to him about something. His snowboarding. We know he likes to snowboard. So 5 minutes have passed. All right, Mr. Wright, I'm going to go ahead and recheck your vitals, okay? All right. So I'm going to go ahead and grab your temperature, okay? All right. So his temperature is now 100.6. Good. Go ahead and feel your pulse, okay? So after a minute, his pulse is now 70. So good, that's increased. Go ahead and grab your blood pressure. So put the cuff on his arm. His blood pressure has now dropped to 142/90. Still a little high, but it's coming down. So the medication is working. Good. And then I'm going to make sure that I document his new vitals. And then I'm just going to periodically come and check on him to make sure he's okay. Is there anything that you need? Okay, hon. So I'll be back in a little bit to check on you, okay? All right. Hey there, Mr. Wright. How you feeling? Good. Well, I'm leaving for the day, okay? All right. So I'm going to give Heather a report, okay? All right. So Mr. Wright is a 17-year-old male who was injured in a snowboarding accident 3 weeks ago. He sustained a vertebral fracture and complete spinal cord injury at his T7. His fracture has been stabilized with rods and screws. The plan for him is to be discharged at home within the next 3 to 4 days. he refused his education. He wants to wait until we get closer to his discharge because he doesn't want to forget anything. Today, after his bath, his vitals went up to 103.6, 56, 20, 189 over 100. After examining him, we noticed there was a washcloth underneath of him. There was a spot that was red on his lower back, but that has gone away now. We believe that the washcloth caused him to go into autonomic dysreflexia. I did put some ice packs underneath his arm and put a cool washcloth on his forehead to help with his temperature. I also administered nitroglycerin 0.4 sublingual. That did help. That did bring his vitals to 100.6, 70, 16, and then 142 over 90, over 90. He was a little anxious earlier also, which that has decreased too. PT and OT came later on today and worked with him, trying to get him ready to go home. Do you have any questions? Mr. Wright, do you have any questions? Okay. Well, I'm back in the morning, so I'll see you tomorrow, okay? You have a good night. All right, thank you.